Assalamu alaikum warahmatullahi wabarakatuh. Good afternoon and welcome. My name is Adnan Burke. Thank you so much for being a part of this special webinar presentation, COVID-19 Game Changer for Life. I've got a couple of terrific guests, as you can see on your screen right now, Dr. Faheem Younus and Dr. Atif Mian, who will be discussing respectively both the medical impact and also the economic impact of this unprecedented pandemic, which has engulfed this entire world. Of course, we're here in conjunction with Humanity First USA, and I pledge and eagerly await for all of you to try to do your best to give fundraising, to give dollars, and to give your time towards this wonderful, wonderful cause. You can do so at any point, of course, during this webinar, of course, after as well, usa.humanityfirst.org, usa.humanityfirst.org. In case you're new to Humanity First, would like a few ideas of what it's all about, let me first tell you a little bit about myself. My name is Adnan Burke. I'm a sportscaster formerly at ESPN for 9 years. I currently work for MLB Network and DAZN. I'm Canadian, don't hold that against me. I'm here living in Bergen County, which is in North Jersey, just outside New York City, which is, of course, the epicenter of this pandemic. I also have 4 boys, so if they don't interrupt us for the next hour, that'll be a minor miracle in itself. In terms of what Humanity First is all about, here's what I can tell you. It's a special organization. They've done lots of work, not only in Mexico, but also developing the National Hospital in Guatemala and Africa as well. But let's talk about America and what they're doing specifically for COVID-19 and this epidemic. So since the beginning, there's 250 active volunteers right now. Once COVID-19, the pandemic, started to spread in mid-March, 300 active volunteers, in addition to the 250 already present, immediately jumped in. 51 different projects, 11 states and 16 cities right now. And here's a little bit of information about what each of these are doing. The food meals program, where 150,000 served mosques in Virginia, Chicago, New York, and New Jersey. There's also a Humanity First USA support line. We all know right now people are dealing with a lot, not only mentally, physically, spiritually, emotionally. So this helpline has been invaluable for medical, legal, and financial advice. In addition to that, there's also been other assistance from Humanity First, including hygiene kits, homemade masks, surgical masks. A lot of work currently is being done. usa.humanityfirst.org. And once again, Humanity First needs help. It should be noted, when you're delivering 600 to 800 meals a day in New York City, I mean, that is a very tough, very unenviable task. And certainly, I know on behalf of Dr. Faheem Younus and Dr. Atif Mian, we want to just thank all of you and all those volunteers for the hard work that they are doing and trying to get this done. And really appreciate what everybody is trying to do. All right, those are some thoughts here for myself. I just got a message here. I know the audio may be a little bit tricky, but we'll do our best to fight whatever technical challenges we have. And all right, I'll make it to my guest right now. As I mentioned, we're going to have not only the guests speaking, and we'll offer some follow-up questions as well, but also there is going to be a question and answer. So according to your screen right now, my understanding is there's a text box which you can utilize. You can submit your question there. We have our own volunteers who will be filtering through all of those as well, and therefore you'll be able to see which questions will be filtered through. But please do send us your questions, text them in, we'll filter through those, and we'll do our best to get through all of those momentarily. All right, in terms of our special guests, enough yammering from me. Let me tell you how special these two guys here are, why it's so important to have them. Dr. Faheem Younus, he's an award-winning clinician and physician executive who is leading the University of Maryland Upper Chesapeake Health's Quality and Safety Program at this 300-bed hospital system. He has provided the vision to develop and sustain programs to prevent hospital-acquired infections, implement antimicrobial stewardship, reduce in-hospital mortality, prevent hospital-acquired complications, and investigate patient safety events and sentinel events. He is a change management expert respected for his ability to transform and align a multidisciplinary team behind a common goal. Dr. Younus was chosen by his peers twice to receive the top doc award given annually by the Baltimore Magazine. He also received the Presidential Service Award from the Obama administration in 2008 for his humanitarian services. He is the author of many peer-reviewed articles. I know he's very humble, so somehow, some way, he's blushing through that bio. And now we can get through all the information again. So Dr. Younus, let's start first and foremost with this. Of course, there's lots to tackle, but why is it, when you look at these numbers, a worldwide pandemic, why is it America has been hit harder than any other country?
Very good question, Adnan, and I think there are multiple answers. Number one, people have to understand that we didn't recognize it very quickly. You know, in February, while the virus was very quietly spreading through our communities, what were we doing? We were having a Super Bowl. We were celebrating Mardi Gras. We were having political rallies. So we lost some very critical time there. Add the 80 million people who travel into US every year, and you have a perfect storm, because this virus that originates in Wuhan, actually the studies are now showing that much of the virus that came to New York came through Europe. So travel has a huge impact on it. And the third, I think the biggest thing is our mindset. We kept on hoping for the best. Hope is not a strategy against this virus. I think this required a much more robust recognition. And I don't want to blame people, because these viruses are sneaky. You know, you tend to underestimate them. That's what other countries did in 2003 after SARS. They learned their lesson. I think we have learned our lesson now.
Exactly, and I think it's a great point you make, Dr. Younus, that you don't want to look back necessarily. I know there's lots of second guessing, and people are saying, you know, there's earlier cases, perhaps in February, perhaps even earlier than that. We should have done more. We should have restrictions, but I couldn't agree with you more. I think it's about positivity and trying to move forward, and certainly second guessing can be done in the history books years from now, but for now, we're trying to move forward as quickly as we can. Here's a question I know a lot of people have been asking. Why is it going to take 12 to 18 months approximately for a vaccine? I know all of us are hinging on every word. We listen to what the CDC has to say. We treat that as gospel. I remember Dr. Fauci saying 12 to 18 months, and 12 months is optimistic. The latest I had heard from the CDC a couple of days ago was by March of next year, there could be a vaccine. Why is it when the entire world is dealing with this, we have so many smart people, so many people working diligently, why is it going to take so long?
Well, I think it's too short, actually, if you ask me, because, you know, let me give you an example. Undergrad can be done in 4 years. A very smart student may do it in 2 years, but there's no way to do it in 6 months. So you can't do your college in 6 months. Certain things have a certain pipeline. A drug typically takes 5 to 10 years to be developed. That's the pipeline of a new drug. The pipeline of a vaccine is no shorter than that. I'll tell you, the SARS vaccine was being worked on, and they were about to launch, but the virus just simply disappeared. So I look at it from a very different perspective. I think it's heroic if we are able to get it in 18 months, because first you have to develop a vaccine candidate. Then you have to do some animal trials to make sure you're not doing more harm than the vaccine. Remember, you're injecting a virus into someone who does not have it. Number 3, you want to then test after safety. You want to see if it's immunogenic, if it's generating enough of a protection, because you don't want a placebo in your arm either. And number 4, you want to then test how long that protection lasts. So if a vaccine trial ends in 3 months, how can we tell you that your vaccine will be good for a year? We did not even test it for a year. You want to make sure that this vaccine will take you through at least 1 year. So those are some critical steps that cannot, even if we want to, they cannot and should not be moved faster than what they're already doing. I believe it's an amazing effort right now.
But you certainly can't mess with someone's health. You're right. And certainly we've seen all the restrictions that put in place. And I'm going to bring in Dr. Atif Mian in a second to discuss the economic impacts. But in terms of the latest when it comes to safety and health regulations, I don't want to say it changes every day, but it does, I think, change week to week. I think initially, certainly here living in Bergen County, it was stay home, of course, stay home, social distancing, 6 feet apart. And then gradually, okay, restaurants are closed, now parks are closed, and now people are wearing face masks. The face mask issue, I think, is particularly interesting because there's a lot of information, perhaps disinformation about it. Do I need to wear a mask when I go for a run? Do I need to wear a mask when I go to the grocery store? Do I need to wear a mask when I'm driving? The issue of mask specific and your own personal safety, if you can elaborate on that, when and where is it appropriate, and what type of mask should I get? Is a bandana okay? Can I get a home? All that kind of stuff.
I was just going to show you, actually. This is the mask that I think people should be using, a regular face mask. Do not use the other bulging N95 because we don't have many of those, and the clinicians on the front line should be using those. When you use this mask, my suggestion is anytime you go outside, and you should go outside within the bounds of the law, otherwise you'll get depressed. This is going to be a long haul. So you have to go out for a walk, you have to go out for biking, maintaining social distance. The advantage of a mask, Adnan, look at it this way. Anytime we cough, we spread around 3,000 small, tiny droplets, and the virus could be in those droplets. Anytime we sneeze, we spread around 40,000 of those tiny droplets. And with the sneezing, we can spread them to up to 6 feet, maybe wider than that, depending upon the airflow and the current. So when I'm wearing a mask, actually I'm protecting you. And when you are wearing a mask, you're protecting me. So we really need to get over the stigma. there is no way, in my opinion, to reopen a society without everyone wearing universal masks at work, in the bank, out there in the park, and in the subways, because that's what Hong Kong did after SARS. That's what, when you look at the Asian countries, you will always see massive utilization of masks. Why is that? Because my mask may not protect me, but it's going to protect you from my cough and sneeze. And here's the last point. What we are learning from coronavirus, that anywhere 20 to 40% of these patients may be asymptomatic, particularly in the earlier phase of the illness when they're still contagious. So just saying, I'm feeling fine, why should I have to wear a mask? Well, you may be in the pipeline. So we need to protect each other. We have to think of each other. It's a symbiotic relationship. Actually, the virus has created a lot of friendship and unity among humanity.
Yeah, I completely echo those sentiments. I've never gotten to know my neighbors better than seeing them every day now.
Yeah.
To your point, going for a walk, double strollers, walking the dog, gardening, and everybody is at least able to smile and wave from a healthy distance. That's a great point you make about the altruism of this, that it's not just a matter of, well, I feel fine and I'm young enough. Even when there was initial reports, it was, okay, well, elderly people are more susceptible, or underlying conditions are susceptible. Well, listen, how could you not have humanity? How could you not have respect for those who are older than you? Everyone has a mother, a father, an uncle, an aunt, somebody elderly they care of. And as we've seen with this virus, it is indiscriminate when it comes to a person's age. In fact, young people can be impacted. And of course, with regards to ethnicity, we've seen African Americans, Latinos, and others really hit hard by this. So I completely agree with you. It's not just about protecting others, it's also about protecting yourself. Let's bring in Dr. Atif Mian as well. He is the John H. LaPorte Jr. Class of 1967 Professor of Economics, Public Policy and Finance at Princeton University, and Director of the Julis-Rabinowitz Center for Public Policy and Finance at the Woodrow Wilson School. Professor of Economics at Princeton, he holds a bachelor's degree in mathematics with computer science and PhD in economics from MIT. Prior to joining Princeton in 2012, he taught the University of California, Berkeley, and the University of Chicago Booth School of Business. Professor Mia's work studies the connections between finance and the macroeconomy, and has been published in various academic journals. He's also the author of the critically acclaimed book, House of Debt, with Amir Sufi. Dr. Atif Mian, thank you so much for being patient, and thanks so much for your time today. Let's start nice and broad, and from there we can do follow-ups. And of course, I encourage Dr. Faheem Younus to jump in as well. It's not just my show here. But simply put, how are we doing economically? When I look at the numbers, 26 million Americans have filed for unemployment. Everywhere stores are shut down. We'll get into the whole issue of Georgia opening up with barbershops, bowling alleys, et cetera. But economically, how hard hit has America been just in the last 6 weeks?
Thank you, Adnan. The first obvious point to keep in mind is that we are living in an unimagined universe. That is to say, no economic forecaster or financial analyst, no matter how smart they may have been in the past, no one predicted this. The economy is in a chokehold essentially by an invisible enemy. And as you very rightly said, we are very much in the process of losing 26 million jobs already. Just to get a sense of the scale of that, that is 3 times the number of jobs we lost in the 2008 recession that everyone kind of refers to as the Great Recession. And so certainly this particular recession is going to be greater still. So that's where we are in a nutshell. But the more important question is, what do we do now, given the situation that we are in, given that we find ourselves in this unimagined universe? The first point, and this is perhaps the most important point, is, and Dr. Younus also mentioned this, is we do not need to panic. There is one good news in all of this, which is in a sense, we know what we are dealing with. When I say we know that this passes ultimately. And so there is a time limit to it. We may not know exactly how long, but we do know it passes. And so it is a time not to panic, but to prepare and organize. And one way to think of how to prepare and organize, if I can use an analogy, is to look at the animal kingdom and think of animals that hibernate. I mean, there are times which are very stressful for you to go out. The season turns in a way that is not conducive to you. That is the analogy that I would use. And this is a time for us, for the economy, to hibernate. Now, when you think of it from that perspective, the key principle of hibernation is that while the animal might appear close to death, it's not actually dead, obviously. But most importantly, the animal is preserving the essentials of life, and it's getting itself ready that as soon as the season turns, the animal can go back to life even stronger. And that's the principle that we need to keep in mind as we think about sort of what economic path to take going forward. So that means first the obvious one, which is we need to prevent people in terms of loss of life. We need to make sure that people have the essentials of life in terms of food, medicine, and shelter. We need to make sure that this hibernation, that collective hibernation that we are in, it does not lead to permanent damage of one sort or another. So let me give you examples of what that means from an economic standpoint. For workers, this means that we need to prevent job separations of the sort that make it harder for employer and employee to come back together. There's a lot of important knowledge that is embedded when a firm and a worker work together. We need to preserve those matches. Similarly, in the housing market, we need to prevent evictions and foreclosures that will permanently disrupt lives otherwise. For state and local governments, the federal government needs to step in and fund their continued operations during this time of high expenditure and low revenue. Again, the key is prevent permanent dislocations. Now, as I mentioned, we are living in an unimagined universe. And that word, unimagined, has important consequences for our legal system and institutions. So that's another important point I want to mention here that's going to become more and more salient as time goes by. In particular, we can no longer pretend that nothing happened. When we typically write contracts with one another, like a financial contract, for example, the contract might say the borrower has to pay no matter what. In the legal eye of the contract, that's what the contract says. But because of, again, this unimagined event that we are all up against, we can no longer pretend to live like that. And so there's going to be a need for massive restructuring and renegotiation of the economy that is going to be an ongoing thing that we have to deal with going forward. The last thing I will say is that there has been this elephant in the room, and I can go into the details if people are interested in the question and answer session, but there's an elephant in the room that we haven't dealt with, which is going to be front and center coming out of the COVID crisis, and that is the extreme levels of inequality. That is something that has to be dealt with. Otherwise, for the economy to go back to normalcy is going to be extremely hard this time around.
To your point about the new normal and how things have to be adjusted, here's the thing that I cannot wrap my brain around, and I really am excited to hear what you can explain with this, is these stimulus packages. Because these numbers, Dr. Mia, are so outlandish to me. I go, hang on, there's trillions of dollars, billions of dollars, small businesses, and you're looking at a guy, son of a small business owner. My parents, when they immigrated from Pakistan, it was a small grocery store living in the middle of nowhere in Eastern Ontario. So every time I hear small business, it's like, oh my God, I'm a child of a small business. I know exactly what it's like. My heart goes out to these people. And that's that whole crux of that argument. Hey, the economy versus health. Okay, I might get sick, but I've got to get back to work. I've got to make my mortgage payments. You don't understand the stress, the pressure. This stimulus package, can you explain to me where all this money is coming from and how much money can we do in terms of keep getting this money, these trillions of dollars I keep hearing about?
Well, let me start with the good news. The good news is that of all the countries in the world, the US is in the best possible position to spend and to go through a large stimulus package. The reason for that is it's something that people in the past have called the exorbitant privilege. That is a privilege that the US has that no other country in the world has, which is that it can borrow a lot more than any other country in the world without hitting what you might conceive as kind of the limit of how much you can spend, because it leads to rising interest rates or other problems of that sort. We as a country, we have kind of gained that privilege because of the strength of the institutions that we have built. So given that, this is the time to utilize that firepower that we have, number one, exactly because these are the kind of periods for which you develop all that muscle power that the US has built over time. So the first thing is it's okay to spend for the federal government, number one. Number two, as you already hinted at, the scale of spending is certainly unprecedented. Even in 2008 recession, that looks like small potatoes compared to what the US government has already authorized to be spending. So it's okay to spend, it's okay to spend big. However, let me just make one broad point as a matter of principle. It is important that you spend judiciously, and it is important that you spend it the right way. And the basic premise or the basic principle of how to spend is you want to spend to protect the most vulnerable. Because the whole point of spending is to go back to this principle that we are all in this together, and we are all connected with one another in this ecosystem we call the American economy. And so it is to our advantage that we pull up the person who's getting unemployed, that we pull up the small business that is losing customers, the restaurants that has no customers anymore, and so on. And so this is the time to spend in intelligent ways to help out exactly those segments of the population. This is not the time to go for, bailouts of the privileged. So that's the piece that we need to avoid. And that's very important. This is why I kind of hinted towards the end of my previous response that we cannot ignore the elephant in the room. We need to make sure that these resources that the US government has, and the US government has enormous resources. Again, let's not lose sight of that. Those resources need to be spent properly, keeping these broad principles in mind. And the last thing I'll say is, one obvious thing about this crisis is that it's driven by a virus. And so we need, and the government needs to spend very aggressively in attacking that problem as well, which obviously means testing, it means contact tracing, it means vaccine development, and all the other stuff that the medical side is working so hard on. We need to devote resources on that aspect as well.
You hit exactly the point that I want to go back to Dr. Younus on, which is testing. We keep hearing this, Dr. Younus, that, hey, when can we just go back to normal? When can I take my kid to the park? When can I do that? I'll wear the face mask, sure. I will do social distancing. I just want to get a haircut. And everyone keeps saying, okay, more testing, more testing, more testing. What does that mean, quite simply? What kind of testing do we need? Where can this happen? How can this happen?
So again, look at it simply. If it's really raining cats and dogs outside, and you say, when can I go outside? Well, when the rain stops. Well, I can't wait for the rain to stop. Well, when you have a good enough umbrella and a poncho, right? That's how you go out. So I think those are the two paradigms here. One, when the virus has burned through the jungle, and I use those terms very carefully because I think if we don't do anything, that's exactly what's going to happen. It's going to burn through millions and billions of populations. And at some stage, yes, it will be safe to go outside. Life moved on after Spanish flu 100 years ago when we did not have vaccines and we did not have antivirals or anything. So that's one option, to wait for the rain to stop. I think it's a bad option, right? Because there's a lot of harm that will happen in the meantime. Now you're dealing with an invisible enemy. This is not rain. You can't see it. So unless you see it, you have to somehow make it visible. You make it visible by broad testing. And that is why the medical community is united on this subject. And the notion that is thrown around in the media that we now have 1 million tests or we now have 1,000 tests, I think is meaningless. There is no number. The way I look at it is an adequate testing. What is adequate testing? When you have a strep test for your child, to me, that is adequate testing. Any mother, any parent can take their children to an emergency room, to an urgent care center, to their own doctor, get the test done, and wait in the waiting area, and within 30 minutes, they say your test is negative or it's positive, and this is how we're going to treat it. That is adequate testing. I think we need to have adequate testing. And then every time we find someone positive, we need to test at least 10 of that person's contacts, whether they're close friends, whether they're family members, because research shows that about 2 out of those 10 will be positive as well. And then you continue to follow that cycle, number one. Number two, it's controversial, but even today, even in many states in US, up to 90% of the deaths, unfortunately, are happening in the people over the age of 60. So at some stage, the question is, can we protect our most vulnerable population, those over the age of 60, those on chemotherapy, those who are immunocompromised? But those who are younger and are part of the economy and really are itching to get back, how can we give them a cautious path? And this is where it gets controversial. How can we give them a cautious path that, you know what, with hand hygiene, with 6-foot distancing, with a face mask, and with a good knowledge that anytime you have symptoms, you will be able to get a test and go into quarantine. Maybe there is a middle ground there, but the key point there, Adnan, is the timing. If you don't have enough tests, if you don't have enough PPEs, if you don't have enough facility to quarantine and contact tracing, stay inside, because you don't have an umbrella and a poncho and it's raining cats and dogs. You will hurt yourself.
It's an excellent.
Actually, I think it's a hailstorm. It's not rain, it's a hailstorm.
Yeah, that's an excellent analogy, and that makes a lot of sense because I saw the most recent stats in terms of your point about antibody testing and contact tracing. They said there could be 2.7 million New Yorkers could have been infected alone, which is a staggering number. And as you mentioned earlier, in terms of being asymptomatic, people may have had it, may not have even realized it, pass it on to others. Some it attacks more viciously than others. That brings us back, Dr. Mian, to the point about the economy and what's happening in Georgia and some other states down south. And the governor kept there in Georgia. Again, we're not making this political, but the fact is they're opening up the economy because they feel like, yes, COVID-19 is not going away, but we need to get back to business. However, the Atlanta mayor pointing out and telling the residents there, no, do not go back to work. We don't think this is the right move. Listen to science, don't do it. How do you balance? Suppose there's a listener right now in Georgia and the bowling alley's open, the salon's open. Can I do this? Can I not do this? How do you know which leader to respect or to trust? Because not everybody clearly is on the same page. And quite frankly, without being critical of them, not every region is being affected the same way. So certainly what Governor Cuomo is saying in New York City or Governor Newsom is saying in Los Angeles is going to be different than some of those other states. So how should you be able to judge what's the right move economically if your state you believe is not being as hard hit as some of the others?
So let me, it's a very important question. Let me say first the following. The answer to this question would be different for the US versus, let's say, Bangladesh. I already mentioned to you that the US has this exorbitant privilege. We are very fortunate that we have that exorbitant privilege. This is the time to use that privilege. We are fortunate that we do not have to make some of those very heart-wrenching trade-offs that a country like Bangladesh, India, others need to make. This is the time to take advantage of that, number one. So we need to value life. I'll just start with that. The second point I will make is that the question is not a binary question of whether we open up or not. The question is, how do we prepare and plan to open up? And how do we make contingency plans for when we will open up more than not? And my look of, we have all kind of become armchair epidemiologists with apologies to Dr. Younus in all of this. So having looked at those, what the effective are and all of that, my take is that once we have the adequate testing that Dr. Younus is talking about, we can follow a simple rule of thumb, so to speak, which is if the effective R is reasonably below 1, which is to say that the number of new infections is going down in a statistically significant way, you can start relaxing some of the constraints that you have imposed on your economy, and you can prioritize things. I am biased, as you can see, but maybe haircuts can wait. But as long as we are constantly testing, and that effective R, which is again telling us whether the new infection rate is going down or not, if we can continue R to remain low, to remain below 1 significantly in particular, you can continue to open. But if it looks like it's coming back, you get ready to ramp up again. Use your exorbitant privilege. This is the time to do it.
To your point of opening up then, what would you do in terms of, what would the first measure you would relax? For example, if I believe the rate of infection the guidelines be given at a federal level, the rate of infections, hospitalizations, emergency visits, et cetera, go down over a course of 14 days. So if that 14 days of descending has occurred, economically speaking, what should be the first businesses that open up? Is it restaurants? And if it is a restaurant, do you say, okay, 10 or fewer people at a time with social distance, 6 people. What does that look like economically speaking to kind of get the economy back going? What do you start to ease first?
That's a very, very important question. And one way to think of this question is exactly to think of who is the most affected, marginalized section of the population, and to think of reverting the economy in a way that helps those individuals first. So I do feel that, we do need to think very seriously about small businesses, for example, and thinking of ways that we will open them up first. But we also need to come up with new innovative ways and use technology. So I'll give you some examples, and I think we are not thinking along those lines sufficiently. That's my view on this. Countries such as China are actually much further along than the US. We can really use technology such as digital technology to bring back to life small businesses much sooner than earlier. So one example could be that the government could actually give kind of coupons that all of us could use, but those coupons are limited, that we can only spend them not on Amazon, which everybody's going in. Amazon is fine. I'm not worried about Amazon or Zoom, but I'm worried about my local grocery store or my local restaurant. So the government can give coupons as part of the stimulus that can only be spent in my local physical single unit establishment that is run by some mom and pop and so on, to bring this spending power to them. And you can then say, look, these are the first sort of small businesses that we will open up, and you can use this free money, so to speak, to go and to start shopping under, again, those protective guidelines like wearing masks and things like that Dr. Younus was talking about. So it has to be a carefully choreographed dance where, but we are, again, I'll point out to the good side that we have not only that exorbitant privilege on the financial side, but this is the country with the best technologies in the world. This is the time to deploy them. And if I have a worry, it is not the scale of the problem, but the resolve or the scale of the effort that we are making collectively. I think at the end of the day, all the failures to a large extent would be ours to own collectively. And that's something perhaps introspectively to look on when the time is right.
Two great points you make there, specifically the fact that once you see those numbers go down, it cannot just be open for business, have at it, it's a free-for-all. It's slowly but surely, let's ease into this. And two, to your point, I think that's absolutely critical for everybody listening. Once you hear in your region or area, hey, infections are down, we have this relatively speaking under control, we're not overburdening our healthcare system, let's get back to it. But if the numbers spike, we're going right back to where it was. This is not just game over, all right, we're dealing with it. Now, okay, let's go back and hardy again. No. Now we have to ease into it. If there's an issue, we have to slide back and push it again. To that point, Dr. Younus, everybody's worst fear, maybe not worst fear, but definitely fear out there. What about this second wave? What's the likelihood that, as difficult as this has been, as much as we can punish this virus, and hopefully, God willing, in the summer we can back to some semblance of a new normal, what about the rumors, and what's the likelihood of a second wave, the inevitability of that happening this fall or this winter when it coincides with flu season?
I think it's perfectly reasonable for us to have the right expectations. Second waves are a given. Pandemics are tournaments. These are not one matches. You can't just go over one peak and declare victory. Previous pandemics don't play that way. You will, and particularly when all you have is what we call non-pharmacological measures like lockdowns, shutdowns. We have very good conversation, like Atif was saying, a calculated release with an understanding that you're going to go back again. So in that sort of a circumstance, yes, this is very likely that once we hit fall and some schools open, some don't, some colleges open, some don't, businesses start reopening, you will have a second wave. You'll hunker down again, maybe in the winter season, once it's influenza and the regular flu-like illnesses everywhere. And if we don't have the kind of adequate testing I talked about, I think it can be a nightmare, because every other person will have cough and fever and people will be scared to death if it's coronavirus. So there are going to be second waves. That is the nature of the beast. But the reality is, the way I look at it, and this is really, I think, based on the data, every month that I'm seeing is relatively better than the previous month. So the times we are getting more prepared, we have more public awareness, and we have better PPE. Our testing capacity is improving. There are more and more drug trials. We are seeing tons of patients on the front line. We are experimenting, and I think our clinical acumen is also improving, where now it is slightly better and people are more comfortable treating some of these patients. So I will say overall, every day that passes without a loss is a day gained. So we have to look at it as a long haul. Whether it'll go away in 6 months or 2 years, I don't know. But yes, ultimately, it's a vaccine or an effective treatment that's going to help us shorten the duration, expect multiple peaks.
I appreciate both of you sending waves of optimism here, because it's easy to get despondent and to feel the bleakness of the situation. I think both of you pointing out, both Atif Mian pointing out, listen, this is a robust economy. This is a country with deep pockets. And as you're pointing out, Dr. Younus, this is a health industry. And of course, heroes like yourself who are working tirelessly, they are making advancements. And like you said, the numbers are going down. One number I saw in New York City had the fewest deaths yesterday since April 1st. It's still heartbreaking to see 437 people dead, but that is fewer than we were hearing before. Let's get to one, and this is one that I shake my head at, but I've seen this question, and I have to ask you, Dr. Younus, because it troubles me when I hear it. And that's people saying, come on, what's the big deal? It's just the flu. There's conspiracy theorists who are saying, and I'll get to this, Dr. Mia, that the economy was doing too well, they had to break this down. There's political reasons. The Democrats are doing it, all these kinds of things. There's lots of people up there, as heartbreaking as to me, who are buying into this kind of nonsense. Dr. Younus first, why is coronavirus, COVID-19, worse than the flu?
So I don't know what the virus is thinking, but I believe the virus is very happy when we say it's just flu, because that's the virus's strategy. It's a very humble sort of virus. It does not want to get your attention and continues to do its job. I'll give you a few data points. The mortality of influenza is 0.1%. The best case today is the mortality of COVID will be 1%. That alone should give us a pause, 10 times the number of mortality. Number two, influenza patient typically ends up infecting 2 more people. Coronavirus patient typically ends up infecting 3 more people. That's the R0 that Atif was talking about. And that small difference is magnificent. It's a mammoth difference when you project it over millions and billions of people. Influenza has been around for centuries. Our body has some immunity against it. This is a novel virus. Everybody is equally susceptible. For influenza, you have a treatment, you have a vaccine. For this, we have neither. Here is another data point. H1N1, the last pandemic we saw in 2009. I don't know if many people remember that, but CDC projects that about 60 million Americans ultimately got that infection. And out of 60 million, 12,000 died over a period of 1 year. Right now, with COVID, we've lost over 50,000 people in America in less than 3 months. Just think about that. You had the worst influenza, H1N1, pandemic stage. That strain killed 12,000 people in a year. This has already killed over 50,000 in 2 or 3 months. I think it's time for us to come out of that denial and not play in the virus's hands. The virus loves that kind of confusion and controversies. There is ample data that they're not comparable.
Much more aggressive and much more lethal. To that crackpot theory, Dr. Mia, the economy was doing too well. The bubble had to burst eventually. It's been so long since we had a real crisis back in 2008. There's always ebbs and flows of the economy. They, whatever that nebulous term is, they wanted to bring it down a little bit because it was going too well. Any sort of logical explanation you could give to someone who says that kind of stuff?
You see, Adnan, different people are swayed by different arguments. So if you are the type who is swayed by conspiracy arguments, there's nothing I can say that will help change their minds. For better or for worse, I'm a very, I'd say, simple man in the sense that it's the data that matters, it's the empirical evidence that matters, and there is absolutely no empirical evidence to substantiate any such theories. This is exactly why I started off by saying that we are living in an unimagined universe. We have never seen anything like that. No one really anticipated that. And it is it's clearly makes no sense to come up with these conspiracy theories. We need to look at the data that is in front of you, that is in front of us, and deal with the situation as best as we can. And we have the resources to do it. We just need to deploy them rather than go crazy.
Dr. Younus, in terms of other pandemics, we've already discussed the fact that a second wave is likely. As you said, this goes in curves. There's going to be peaks and valleys. For those that say, okay, well, this has only happened 100 years ago, 1918 influenza epidemic as well. What's the likelihood of another virus or something akin to this happening, and how can we prevent that moving forward?
I think the likelihood is much higher, and this is why. In 1918, when we had Spanish flu, remember that was the end of World War I. There was not global travel back then. Aeroplanes didn't exist the way they exist today. Much of that virus actually went global when the soldiers went back to their countries and they took the virus with them. Now we had more than 4 billion people traveling globally. There are estimates that millions of people actually left Wuhan before we even detected the pandemic or this strain of virus. So with that sort of globalization and fast travel and fragile economy, I would say very robust on one end and very fragile on the other side. You see that how quickly, what it takes to shut down our lives. My feeling is these will be more likely moving forward, and we have to get better prepared.
I was really struck by the story Governor Cuomo told yesterday in New York, which is of a Kansas farmer who wrote him a letter and said, I know you're too busy, I'm sure you're not going to read this, but my wife and I have an N95 mask, and we'd like to donate this, and please give it to a doctor or nurse there. I mean, it's tough enough to see a story like that and get choked up at the generosity and compassion of Americans everywhere, and just somebody in middle America trying to help. What can the average Americans do? All those listening right now, beyond giving up finances, beyond staying at home, what can we do to help those in the front line like yourself?
So I think there are multiple angles. One is Frontline. I'll tell you my own experience. The amount of pizzas and free food that we physicians have received from the restaurants in my area, I didn't know that many restaurants existed. So the outpouring of love from people in the society is highly appreciated. I will also make sure that when people think of heroes, I don't want them to limit it at doctors and nurses. Anybody who's out there, your mailman, the person who's collecting the trash, the police officers, the firemen, or the people who are working in healthcare in other places. It is nerve-wracking. I'll tell you, it is exhausting. And the help we get from people. The other day, some of the local churches sent us tons of masks, ladies who made them at home. They didn't care about what the science was. They just went ahead and did what they thought was right. The local Home Depot just dropped off hundreds of N95s, which they had. So I think there's a lot of outpouring. That's number one. We appreciate that. What an average person can do, and I completely agree with Atif, this is a great equalizer. The virus isn't going to care if you're a multimillionaire or if you're living under a bridge as a homeless person. To the virus, they're both equal opportunities. So I think donate. If God has blessed you with resources, go out and donate. Try to do your part. We all talk about these big corporations not paying their taxes. They're answerable for that, not me. But if I'm blessed with more, if I'm a landlord and I have a rental property, this is the time for me to reduce that rent by 30% or whatever. I mean, those are the things people can do in their own sphere. On a larger point, I must say, and I don't know if it's politically correct or incorrect, but please stop pressuring your governments. I think when we go out and pressure governments into making scientific decisions one way or the other, lockdown should be opened or it should not be opened, I think that's something we're hurting ourselves. I'm not making a First Amendment issue. I'm not a politician. All I'm saying is, sir, you are hurting everyone. It's just like a surgeon who's operating on your heart. You would not come and talk in the ear of that surgeon. You'll let him do his job because your life is in his hands. We're all in it together. Let's not pressure each other. I'm a physician. I have 20 years of experience. I'm very open to agreeing to anybody else and coming to a middle ground because I know I'm not perfect. I don't know everything. So let's stop pretending that anyone knows everything. We're in uncharted territories. So we have to also come together, and that's something people can do. Have some flexibility.
Yeah, you see those images in the news, and it's concerning on multiple levels, one of which you don't see social distancing. Two, to your point, you're seeing social and civil unrest, albeit on, I suppose, a pacifist manner, but still you worry about where this could go to and that level of anger and disobedience, et cetera, and how this became an issue of a lack of respect for those in power and those who are leaders. I think you're right. It'd be nice if everyone was respectful and tried to trust what they're doing and say, okay, clearly these are people who are in charge for a reason, that they're looking at science, they're looking at data, and this is certainly challenging to everybody. Let's just try to get through it as best as we can. Once again, Humanity First, if you can go, the specific one you can donate to, it's We Care for COVID-19 Response. So please do go on the website and go to usa.humanityfirst.org. We Care for COVID-19 Response. That's specifically helping those people. Dr. Mian, I'm wondering about this. America is a superpower. America is the biggest, the baddest, the big boys on the block. How is this going to impact America's place in the global economy after getting hit harder than any other country? For those who are arrogant enough to say, well, we're not Italy, we're not China, we're not Wuhan, we'll handle this better. Clearly the virus does not care. How is this going to impact the US's role in a global sense?
Well, first, again, as I said, that in the past, the US built this exorbitant privilege. So we had built this strength that we now have the luxury of using. However, the rest of the world is looking at us just like they're looking at everyone else. And it does not matter how many boasts we make in terms of, how great we are and all of that stuff. They are going to look at the evidence, and they will see which country was actually the best in being able to come together and being able to fight it together as one and help each other out, and which country, despite its greatness, was not able to do that. And that's going to change people's perception of what America can do. And perception is everything. For those of, since you asked me a geopolitical question, perception is everything. And if the rest of the world starts to get a sense, well, wait a minute, these Americans, they don't have their act together. They can't even deal with a public health crisis, let alone a bigger geopolitical crisis. That's going to seriously damage the reputation of the US. So that's point number one. Point number two is related to that, which is our ability to come together and organize on a massive scale. When a challenge like of this sort comes about, or any other big challenge comes about, it's not business as usual, which means you have to retool yourself, you have to retool your administration, your organizations, and so on. And people are seeing how effectively the US can do that, as opposed to countries like China and so on. So I think this is a very real challenge. We do need to step up and make sure that those advantages that the US accumulated over time are not only sustained, but let me just say one last thing. Imagine that the US used this exorbitant privilege to give back to the rest of the world at this very time. Imagine the US using that exorbitant privilege of being able to borrow very cheaply to say, you know what, we are going to use that power to not just create the next vaccine, but we will give it for free to the rest of the world because we have the resources to do that. Or we will use those resources to lower the debt burden of these very poor indebted nations of the world. This is the time to really show through action not only how strong you are, but also how generous you are. Because once you make an impact on people's hearts, that's when you really have a long-term geopolitical advantage.
Thanks so much to Dr. Atif Mian and Dr. Faheem Younus. I know how busy both of you guys are. This has been invaluable for all of us. I myself am very encouraged by what you've said. It's been not only informative, but as I mentioned, optimistic, which I think is something we can all use in times like these. I know how busy you are. I am not busy as a sportscaster, and the sports world right now on hold, so I hope we get games back at some point, maybe with empty stadiums. Manam Naeem is going to join us in just a second, but as we thank Dr. Faheem Younus and Dr. Atif Mian, I want to play a video. Hopefully this will work. Fingers crossed. Technological marvel. Here's a video, short video here, Humanity First, what it offers right now, what this organization is all about, and then closing thoughts, Manam Naeem.
A humanitarian crisis or disaster is defined as a singular event or a series of events that are threatening in terms of health, safety, or well-being of a community or a large group of people. Tens of millions of people face life-threatening calamities, lives ravaged by never-ending conflicts, war, famine, and natural disasters. Today, as we stand knee-deep in a pandemic, this definition is haunting every corner of our world. Yet, extraordinary things can happen when we decide to serve humanity. Humanity First was born in 1995 in response to the Balkan War's devastating plight. The first convoys were prepared and set out from the United Kingdom and Germany, carrying supplies and relief for the besieged Bosnians. Serving mankind has been our motto across the globe. We strive to create a sustainable environment for people to live and prosper, and to be available to serve when natural disasters strike. The evolution of Humanity First is reflected in the people we have helped for over 2 decades. The woman who could not see and was given the gift of sight with a life-changing cataract surgery. The children who laughed and smiled when they saw clean water come from the ground and realized they will now have water for life. The boy who no longer needs to walk for miles and miles for an education because of a school built in his village. This village had almost no one who could read and write. The man who sat among the ruins of his home, devastated after Hurricane Harvey hit, relieved to see the group who came to help clean all the debris from his home. And another who was told by every doctor in Guatemala that he will not survive, but found free care that saved his life when he came to visit Nasir Hospital, a hospital built solely on donations. When a huge tumor was discovered in Siapia's small body by Humanity First mission doctors, he was able to travel from a village in Liberia to Baltimore, Maryland for a life-saving surgery at Johns Hopkins Hospital. Now, due to the crisis of COVID-19, we are seeing an increase in death and hunger in every city, state, and nation. Knowing no limits, the lives of the poor, the elderly, and the sick are affected the most by this virus. Humanity First USA has risen to the challenge of these unprecedented times by launching its HF We Care campaign to serve the people of America. Humanity First USA has served over 100,000 meals to the elderly, the hungry, and needy in America. Nurses and doctors on the front line are struggling for the lack of personal protective equipment. Humanity First has acquired donations of more than 10,000 masks for frontline workers and also started a Make a Mask campaign. Volunteers have signed up across the nation to be servants of humanity, risking their lives to help others. Today, it is our duty as global citizens to come together and inspire change, to stand up and be part of an organization which strives to be there for others. As the founder of our organization said, voluntary giving out of benevolence or the art of returning more than others leads to the highest stages in human relationships. Donate and be a part of Humanity First. HF We Care, serving mankind.
But as we close up shop here, Manam Naeem, who plays an integral role here with regards to Humanity First, I hand the baton off to him for some closing thoughts, and I don't begrudge you for making me wear a tie, but it was a pleasure to be a part of this. Go ahead.
Thank you, Adnan. I really, from Humanity First perspective, I'd like to extend my sincere thanks to Atif Mian and Dr. Faheem Younus. I know you've taken the critical time, and I know that there were a lot of questions that were going to be answered and asked as well, and we ran out of time, but for sure we will get the answers, and we will either do another webinar and or answer those questions somehow on our website. I just wanted to, first of all, extend my sincere thoughts and prayers for all those who have lost their lives out there. The number is so huge that in the worldwide, as Dr. Faheem Younus mentioned, 195,000 people have lost their life, and in America alone is 51,000. So our sincere thoughts and prayers for all those who have lost their loved ones. And also our prayers and thoughts are with those that are struggling right now. In US alone, 900,000 plus people got infected, and the worldwide is 2.9. So our sincere thoughts and prayers are with them. And I'd like to really extend our salute to the medical professionals who are out there helping us to fight, this situation here, risking their own life. And I also like to extend our salute to all the frontline workers, whether that is the delivery man or the store clerk or the law enforcement agent or the government workers. All of those, really, I think they deserve our thanks and our prayers and our salute to all of them. Also, I would like to extend our thanks to the social agencies that have stepped up, doing tremendous amount of work that is desperately needed. Believe me, I think when you hear the stories from the ground, it is just heart touching and bring tears to your eyes that people don't have money, literally have money to eat food there. And there is so much, going on from that perspective. And I really like to extend my thanks to the Humanity First volunteers. There in America alone, we have roughly 300 volunteers that are working hard, and whether they are running the food pantries or whether they are doing the home deliveries of food, whether they are making masks, all of this work is going on. And not only in US, but across the world, there are 58 countries where Humanity First teams have stepped up and serving from West Africa to Asia to Pakistan to in America and North America, Canada, Germany, all of these countries have stepped up. And we were just talking about this morning that roughly in just last 35, 40 days, we have served over 3 to 3.5 million meals. So this is an amazing work that volunteers have stepped up, and I really like to extend our sincere thanks and to all of these volunteers who are taking the risk, who are going out there. I will tell you a story from New York. New York, which is the epicenter, which was the worst situation that and any city could be in after obviously in Italy and all that. But people, the volunteers called from there, they said, no, we want to go out, we want to serve. And they started to serve 700 to 800 to 900 meals daily, home deliveries, because they care about their fellow human. They told us people don't have the food, people need help. So this is really amazing work that people have stepped up. I also like to extend my thanks to the Youth Association of the Muslim Community and the ladies that have stepped up in delivery work. Really, these youths are coming forward and doing all of the great work. So I like to say my thanks to all of them. Then of course I would like to say my thanks to all of you who have joined us today. I know that this taking the time and also donating, we are a growing organization, so this is our 25th anniversary worldwide. In US, we've been here for almost 16 years or so. But this was our first webinar, and we are hoping that we will do more. We'll be able to share this video on the YouTube. Please see it. And if our story touches your heart, if something that we talked about today resonated, I think the talk that Dr. Faheem Younus had and talk that Atif Mian has and the time they have spent, and we really urge you to spread the word for Humanity First, because I'm telling you that from the volunteers across the nation, across the globe are telling us help is needed. There are people, this is never has been, in our life, at least I have not seen a situation like this right now. And the countries that rely on us, the people that rely on us, they are calling us for help. So I really urge you to just come forward and do whatever best you can. Engage your friends. If you can volunteer time, do it. If you can donate, do it generously, or at the least pray for all of these guys. So I like to close this session with observing a moment of prayer, moment of silence, however way you want to do it, because I think a lot of people are in pain, and I think a lot of people deserve our prayers. So from that perspective, we should join together and let's observe this moment of prayer and moment of silence for those who have lost their loved ones, and for those who are struggling, and for those who are working hard, and for our ability to continue to serve. Thank you, and please stay in touch. Visit frequently our website, and we will be hopefully doing another webinar. Send us your questions, and we can request Atif Mian and Faheem Younus as well again to come back here. So please join me in the observation of moment of prayer and moment of silence. Thank you, and that brings the program to a close. Thank you so much.